All right, we are recording. So welcome everybody to today's training on healthcare and human trafficking, a survivor-informed approach to victim assistance in the healthcare setting. I'll be your presenter today. My name is Kenzie. I'm a human trafficking case manager. Okay, so by the end of today's presentation, you can expect the following: to be able to define human trafficking while using proper terminology, understand the SOAR framework for working with victims of trafficking, understand the core competencies for human trafficking response, recognize and use different approaches depending on patient-physician relationship. And like I had sent out over the weekend, just to be mindful of time and getting the most material across today that I feel is going to be most beneficial for y'all. I omitted the specific materials on patient-physician relationships, but pieces of that will be talked about throughout today's presentation. You'll be able to implement and use the PAIR model when you suspect someone may be experiencing exploitation. And we're going to talk a lot about how you can promote resiliency and what resiliency even is. So today's agenda is we are going to just kind of start today by talking about human trafficking. What is it? What does this look like? Then we will move into a public health approach. What is that? What is a public health approach to human trafficking versus a criminal justice approach or other approaches that we might see? We will discuss in depth the core competencies in human trafficking response in healthcare. We will do an overview of the SOAR method and an introduction to the PAIR method, which are both different ways in how to respond to human trafficking. They are similar, but they have different pieces of them. That's why I think they're both really important to cover. And then again, we're going to talk a lot about resiliency today. So a few things about me. Who am I? Who is this person talking to you and teaching you all of these things? My name is Kenzie. My pronouns are she, her. I have a dog named Blair. She just turned 2 last week. And I have 2 cats, Frederick and Russell. They're something else, let me tell you. I think we adopted the craziest animals on the planet, but we love them dearly. I have 2 nieces and a nephew and another niece on the way. My favorite food is anything that involves pasta. If I'm eating pasta, I'm always happy. And I recently got married to my high school sweetheart. Other things I enjoy doing outside of working with survivors and being able to, raise education and have these conversations. I really like photography. I run my own small little photography business outside of this work. And I really enjoy listening to podcasts, basically anything true crime related. I really enjoy art and being able to express myself in that way. And one of my favorite things to do is just sit on the couch and watch TV and not really have to do anything. I received my bachelor's in social work from the University of Wisconsin, Eau Claire, and I have a minor in human behavior and environmental interactions. And I'm a certified trainer of this content through the MGH Institute of Health Professionals and Heal Trafficking, which is an organization that works in medical and healthcare to talk about human trafficking and what that looks like. So I work for the Family Support Center. We are a nonprofit domestic violence, sexual assault, and human trafficking resource center located in Chippewa and Eau Claire County. So we have a few different offices because we provide a variety of services. So in Chippewa, we have our domestic violence center, which is also known as the Purple Building. And then we have our sexual assault outreach office, which is uniquely located on the 2nd floor of the post office right downtown Chippewa Falls. And then in Eau Claire, we are the sexual assault service provider for that county, and we have our main office located downtown. And then we also have this unique position at the UW Eau Claire campus called CASA, the Center for Awareness of Sexual Assault. So that is a unique resource to survivors that are on campus or survivors of college aged or anybody of any age can seek those services. But since we know that people around that college age, like 18 to like 26-ish, are at heightened risk for experiencing sexual violence, we have a cool partnership with the university that allows us to work on campus but not be employed by them. So we have that confidentiality still. We offer a wide variety of services here. So advocacy-based counseling, medical and legal advocacy. So when we look at medical or advocacy-based counseling, how that differs from regular therapy or counseling services is we aren't necessarily licensed. Some of us are, some of us aren't, but we are not going to diagnose. We're not going to put pressure on anybody to do anything they're not ready to, or talk about anything they don't want to. So it's survivor-led, it's empowerment-based. We meet folks where they're at, and that's where we stay. Looking at medical and legal advocacy. So if somebody has just experienced a trauma, an assault, we can accompany them to the hospital to kind of be that safe person there for them while they're going through that experience, whether that be a forensic exam or just a checkup with a gynecologist or somebody coming to the emergency room after just experiencing domestic violence. We can be there to support them in that way. And with legal advocacy, we're not attorneys, we can't give legal advice, but we are able to help with things like restraining orders, or in Chippewa County, we help with individuals that have no contacts and safety plan and talk about what that looks like for them. We can help with filing for divorce. We can't file anything, but we can talk to people about those processes and what that looks like for them. We offer a variety of support groups throughout our community. We don't have a shelter on any of our agency's properties, but we do partner with local shelters and can provide emergency placement as needed, depending on circumstances. And we have a 24/7 crisis response hotline that is operated by staff of our volunteers. And then we also have staff backup to those volunteers, so someone is always able to access that service. And we can provide any of these resources on that crisis line as well as in office. And where my position is a little bit more unique. So I am not only a human trafficking case manager with Family Support Center, I am one of the core service providers on the Wisconsin Department of Justice's Enhanced Collaborative Model Task Force to Combat Human Trafficking. That is a mouthful. We usually call it the ECM here at Family Support Center, or when I'm with the task force, it's the Wisconsin Anti-Human Trafficking Task Force. So this is comprised of a few different elements. So the main purpose of having an enhanced collaborative model task force is to collaborate more swiftly with partners, so law enforcement, prosecution, advocacy groups, to create more of a streamlined support network for survivors in Wisconsin. These task forces are all across the nation, and ours is relatively new. We're still building the task force from the ground up. So as you can see in this graphic here, there's different elements and there's different stages. So we're in a little bit of the beginning, which is that building process, but we still work with survivors. We're still doing all of these steps. We're just now coming together as one big team to, like I said, make that a little bit more streamlined. So it's comprised of the Department of Criminal Investigation, our task force coordinator, a program and policy analyst, different special agents, and then state specific agents as well. We partner with the FBI, Homeland Security, and different tribal agencies, and then our victim service provider. So Project Respect is our lead provider on the task force. One of the members of that is on this call today, and then it's overseen by Jan, who you will see in some of the presentation material later on. And then Family Support Center, we serve the northwest region of Wisconsin, and then you have the Fox Valley area, which is UMOS. And they serve that side of Wisconsin as well. So we have the three primary service provider agencies, and then we also have prosecution. And what that looks like is we have our state prosecutor, our federal prosecutor, and our SVU special investigator. So we are just a really good group of folks for connecting people to other resources. I'm not the only provider for this region. I'm just kind of that point of contact that can refer folks to others in areas that are not in my primary service area, which is that Chippewa and Eau Claire County space. And just a bit of a warning for folks, we are going to be talking about sensitive contact. We're talking about human trafficking, which includes elements of sexual assault, domestic violence, all of those hard things. So please take a moment to, think about what you need to do to take care of yourself. You can keep your camera off, you can turn it on, ask questions, step out of the room. If you need to pull out a coloring page and doodle while we're talking today, all of that is okay. I just want to make sure that everybody is aware of the content that we're going to be discussing discussing and is prepared for any potential triggers, because there might be survivors in this space, or there might be people in this space that know survivors. So just keeping that in mind. So before we dive into our next section, which is what is human trafficking, does anybody have any questions or comments? All right, then I will go ahead and get started. So what is human trafficking, right? I want to start off by talking about language. One of the things I wanted to really focus on today was what language we're using. So throughout this presentation, I will be talking about client-patient relationships, so a person seeking or obtaining your service. Because we're talking about healthcare, I'm going to be using patient more frequently. And in the role that I have, we actually have steered away from using language like client. We are actually using participant, because these people are participating in our services. They're not somebody that is forced to work with us. They're somebody actively engaging in that. So you might hear me shift between patient, client, or participant. And then a trafficked or exploited person. So an individual who has experienced or has an experience of trafficking or exploitation. And then the language of victim or survivor, right? It's we don't always know which one to use. What do they mean? Well, for today's content, a victim is someone who is currently experiencing exploitation or trafficking, and a survivor is someone who is no longer actively experiencing that trafficking or exploitation, but is rather working on that healing journey or has already gone through that process. And in your work, you can use whatever language feels more fitting, but we always encourage you to use the language that is self-identified by those victims or those survivors. So kind of moving forward, a lot of the times I hear language like a modern day slave, or even words like white slave. That's been in some of the research materials that I've used today. And I feel that that is neglectful, and it contributes to this racially charged narrative, and it neglects our nation's history of slavery and the experiences that Black slaves have had during that period of history. And so I would highly encourage you to not use language like that when talking about human trafficking. Everybody kind of has their own opinions on what that looks like, and different research and different groups have different opinions on what that might look like. And I feel, after having worked with many survivors, that using that language is not one that any of them have identified as or have even talked about. So I would give you the option to consider that self-identification piece. What are they calling themselves? What providing alternative language is key when maintaining this trauma-informed and empowerment-based care. So somebody presenting in your emergency room or in your clinic, they might not use language like human trafficking. They might say that they have been sexually assaulted. They might say that their boyfriend is making them, work and do a job that they don't want to, right? Their employer is just not paying them enough, or is behind on their paycheck, right? They might not know the language or even see their experience as one of being trafficked, because the language of human trafficking is in pop culture, it's this like huge, big, bad, scary thing. And it is a big, bad, scary thing, don't get me wrong. But because of the way it's been portrayed in our media, it has steered people away from using that language to self-identify their experience. So to define trafficking, so sex trafficking is the recruitment, harboring, transportation, provision, obtaining, patronizing, or soliciting a person for the purpose of a commercial sex act, which uses force, fraud, or coercion. When the person has intended to perform such act is not reached the age of 18, that element of force, fraud, or coercion does not need to be necessary. And also, individuals under the age of 18 might not have somebody that we can define as a trafficker, or anybody at any point might not have somebody that is defined as a trafficker, because not every time that somebody is exchanging sex for something is doing that under the the control of somebody else, there are moments where people are in a position where they don't have any other choice. And that is still considered trafficking if there isn't somebody holding those strings and, controlling their movements and who they're with and that type of a thing. When we look at labor trafficking, that is the kind of those same things, the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through, again, those same elements, force, fraud, or coercion, for the purposes of subjecting them to involuntary servitude, peonage, debt bondage, or slavery. And we see this in a variety of different places. And we'll talk more about what that looks like later on, in addition to what those elements of sex trafficking are. And the next slide that we're going to talk about, the next few of them are, we're going to do some myths and facts. So if folks want to unmute and shout out their responses, if they want to drop it in the chat, these next few slides are going to require participation. So, myth or fact, victims of sex trafficking are sold for sex by a partner, family member, or employer. Okay, got quite a few in the chat so far. All right, lots of facts. So far, everyone has said facts. You guys are right. This is true. And sometimes people get tripped up by this because victims of sex trafficking are sold for sex by all of these different people, right? It's usually somebody that they know, somebody they're close with, somebody they trust. Very, very rarely is it somebody that they don't know, somebody that has just grabbed them off of the streets, right? That's a common misconception that we find in this work. All right, next one, myth or fact. Some signs of trafficking are wearing clothes for the wrong season or weather, being a person, the only person of a specific race or ethnicity in a group of people, having a fear of authority, an inability to live independently, or having an unusual or distinctly identified tattoo, such as a name or a barcode. Okay. Lots of facts. This one is a little bit of a trick question, but this one's actually more false because these are not necessarily signs of somebody being trafficked, right? Any person anywhere in the world can be one of these things. How many of you know somebody with a name tattooed on them? Yeah. Probably a lot, right? I know my dad, my brother, they both have their kids' names tattooed on them. That doesn't mean that they're being trafficked. Somebody with an inability to live independently, they might have a cognitive disability that requires them to have care 24/7. That doesn't mean that they're being trafficked. These are things that can coexist, but these are not like the warning signs that we need to be looking at to define somebody as having experienced trafficking. These might play a role or be a part of that, but they're not like that distinctly identifying piece that we often see in pop culture. Any questions with this one? Because I know a lot of people said that this was true. Okay, so the next one, traffickers often search for people with vulnerabilities as they are easier to take advantage of and maintain control. Some examples of these include homelessness, domestic abuse, poverty, having an increased ACE score, so adverse childhood experiences, or having drug or alcohol dependency. All right. Yeah, lots of facts in the chat here. That is true. This is a fact. We see that the number one cause for human trafficking, or the number one reason as to why folks are brought into an experience of exploitation, is because they have experienced some type of adverse experience in their life already. And I really want to point out that drug or alcohol dependency, because that might not be something that brings somebody into trafficking, but it is something that a lot of people end up having to deal with after an experience of exploitation, whether because it was used to maintain that control over them and have power over them, or because it was used as a coping skill to deal with the trauma they endured during that experience. Yeah, Liz in the chat, experience in foster group homes was a lot of vulnerability. Yeah, we'll talk a lot about the overlaps of youth involved in the foster care system and exploitation in a little bit. All right, next one. So predators of trafficking often use social media platforms to find and recruit victims using techniques like grooming to establish a relationship and gain trust. Okay, lots of facts. All right, you guys are getting good at this. This is true. The A lot of recruiters of trafficking, and it doesn't always mean that it is the trafficker itself. It could be somebody under the control of somebody else having to recruit more to maintain that status, to not be victimized as harshly as others may be, using platforms like social media, Instagram, even dating apps, like even Tinder, things like that. They can use to sweet talk, to give them the needs that are not being met in other places in their life, especially those with vulnerabilities, right? They're going to talk to them and say, give them everything they want, tell them everything they want to hear, get that validation, that love, that support, and then that's used against them, right? And we'll talk more about that throughout the presentation today. Movies, TV shows, and other forms of mainstream media portray human trafficking accurately are a useful tool in learning how to help survivors. All right, good. I'm glad y'all are listening. This is a myth. And that is because we need this like image of somebody being trafficked, being pulled from the mall or the Walmart or Target parking lot, and they're thrown into this white van and they're taken to this house full of other women who are laying on these cots, and it's dirty and gross, and they're all it's all of these different images that are not accurately depicting the majority of survivors' experiences. Does that happen to some individuals? Yes, it does, but not to the majority of them. And we are neglecting those experiences when we only focus on these ones that catch people's eye and get that attention and have that clickbait effect, right? So they are in some ways a useful tool to learn how to help, because you see that by having access to resources, they are able to get their life back on track. But that's not what they're trying to tell you in these things, right? They're trying to just get that attention and get people to watch, get those reviews, that kind of stuff. Okay, any child under the age of 18 who has sex, whether that be forced, coerced, or otherwise consensual, is legally defined as being trafficked, regardless of if a trafficker is identified. I kind of already gave y'all a hint to this one earlier. All right, yes, fact. Anybody under the age of 18 cannot consent to sex, at least in the state of Wisconsin. That does differ across states, but in the state of Wisconsin, no child under the age of 18 can have consensual sex, and especially not transactional. And where this gets really sticky is we don't have safe harbor in Wisconsin. And if folks here are not familiar with safe harbor, that is a law that makes it so that way children cannot be charged and prosecuted for prostitution. Because how can somebody unable to consent to sex be charged for prostituting themselves? It doesn't make sense, but yet we don't have this law in place. So children are not protected. And one of the reasons that I hear a lot as to why that this law hasn't been passed, or this bill hasn't been passed, is because they see this ability to charge these minors as a way to introduce them to systems. Okay, I can kind of understand that, but at the same time, there are other ways to introduce these children to systems. That does not mean charging them and introducing them to the child youth justice system, because that is also not helpful in getting them access to those comprehensive services that they're going to need to learn that what's happening and what they're doing is not healthy. And of course, once they're over the age of 18, they have the ability to make their own decisions. But when they're not, we have an obligation as adults and as safe people to intervene and have those conversations with them without the risk of them getting in trouble, right? That's one of the big reasons why youth avoid reaching out to services when these types of things are happening. All right, last one, I promise. So effective intervention often takes time and patience, as trafficking survivors are not in need of rescuing or saving, but rather needing support and meeting their basic needs, gaining help in unlearning those harmful behaviors and regaining a sense of self. Okay, lots of truths. Yep, lots of facts. This is very, very true. It's not a one size fits all. It is not a quick process in healing from trauma. I'm sure anybody in this space that has experienced a trauma knows that you don't just get over it. You don't just move on. What you have to do is you have to learn how to live with that trauma as a part of you, to where it doesn't affect your everyday life, right? You're never going to get rid of your trauma. It's never going to be fully healed or disappear. You're just no longer going to be activated by it. It's no longer going to control you or your life. And that takes time. It takes patience. A lot of the times trafficking survivors are not the most enthusiastic or excited or wanting to work with other people on talking about their experience, or they don't need to be saved. They do not need to be rescued. These are people. They have autonomy. They have their own ideas and knowledge of what they need and want in order to flourish. We don't need to tell them what that is. We don't need to jump in and be the one saying, you've been trafficked. I'm here to help you. I'm saving you, right? We don't need that savior complex. Okay. Other common misconceptions that we see a lot when we talk about trafficking. So only undocumented foreign nationals are trafficked in the United States. That is not true. We do see that more often in labor trafficking, there are folks that are undocumented, and that's because they have more opportunities to be controlled and manipulated into that type of a situation. But that does not mean they are the only ones that experience trafficking. Human trafficking only happens in illegal or underground industries. Again, not true. Human trafficking is illegal, right? So that part of it is true, but it's not this like illicit underground brothel that, only the rich people have access to. It happens every day in every county, in every state across the country. Human trafficking involves the moving, traveling, or transporting of a person across state or national borders. Not true with human trafficking. That is human smuggling. There can be elements of that at play with human trafficking, but that is not what human trafficking is. And that people in active trafficking situations always want help getting out. Also not true. Sometimes they might love their trafficker. It might be their intimate partner. It might be their parent. It might be somebody that they really admire. They might not recognize that what's happening to them is wrong or bad, and they might not see that they need to get out of the situation. They might believe that they are consenting and that they are doing this of their own free will because they don't recognize that control and that manipulation. And we are not there to tell them that you have to get out, that this is a terrible thing. We can certainly feel that way, but our job is how to help keep them as safe as possible and help educate them on what is happening so they can make their own decisions, and we can help them get access to the resources needed to get out of that situation if they so choose, right? If this is involving a minor, that's a little bit of a different story, right? Because we have that obligation, especially those that are mandated reporters on this call, to intervene, to get them out of those situations. So that one's a little bit different when we're talking about minors and youth. But when we're talking about adults and people of consenting age, it's not our job to rescue or save them. So the harms that can be caused by these misconceptions, so they lead to dangerous rumors, which take on social media, and they create this climate of unnecessary fear. I mean, how many people here have seen those posts of, oh my gosh, they left a flower under my windshield wiper, and that means that they are coming to traffic me. They are targeting my car. I need to be careful, right? I mean, I've seen that all over Facebook. Just yesterday, I was on Facebook and I saw a post about people putting water bottles in, like plastic water bottles in your like wheel well of your car. And I was shocked that this article didn't mention that it was a ploy to traffic people, but it was like a ploy to be able to like rob them or come after them or steal their car or things like that. So it creates this climate of just unnecessary fear. Yes, do we need to be aware of how to keep ourselves safe in these situations? I think that's very true. But to say that things like seeing a white passenger van or I don't know how many of you saw the big blow up on the news about children being shipped in these overpriced containers on Wayfair. There's a really good podcast that, oh gosh, I can't remember. You're Wrong About. They do a whole story on that situation there too. Or like, right, zip ties and marks on windows and vehicles. They also lead to this inaccurate representation of trafficking, either too vague or too specific, right? When we hone in on one particular kind, we're not looking at all of the other forms that it happens in. It can create dangerous situations for both the victim survivors and bystanders. It neglects that experience of victim survivors, and it creates unnecessary intervention. So if somebody is, working at like the restaurant you're at, and they don't speak much English, and they are kind of keeping their head down, and you intervene because you suspect that they might be being trafficked, and that leads to questions with their employer. It leads to possible identification of them being undocumented or things like that, and then it creates this whole problem, this whole misappropriation of those services, right? You might have had the good intention of intervening and wanting to help this person, but now there's more issues that have to be dealt with, right? Inaccurate training, right? So when you are getting training from on human trafficking, you're always going to want training that has survivor input. And all of the materials I'm using today are from a curriculum that was developed alongside survivors and with survivors. So while I'm not a survivor of human trafficking myself, all of the materials I'm talking about today have come from lived expertise. So you always want to make sure that that is a part of the material that you're getting trained on, because if you're not hearing from the voices of survivors or getting information that comes from those survivors, it might not be the most accurate. It might just be some of that clickbaity type stuff. And again, that savior complex, the belief that we need to rescue these victims because they can't save themselves. And Amanda dropped in the chat the two podcasts that I was talking about. So the You're Wrong About podcast, there's one specifically on human trafficking, and then there's that one on the Wayfair cabinets and shipping children across the world. Okay, so when we look again at this definition, so human trafficking is a crime, so a specific legal definition that involves exploiting the use for financial or material gain through those elements of force, fraud, coercion, a person for labor, services, or commercial sex. So a transactional activity for which someone would expect a compensation. So when we look at things like sex work, people who are consenting adults actively engaging in sex work, these are criminalized in most jurisdictions across the United States because it's that transactional activity. And there's a lot of conversations on reducing buyer demand. When we eliminate the buyers, we eliminate the need for this type of a service, right? That in an ideal world, that would be wonderful. We didn't have to worry about things like that. But in the world that we live in today, that is the reality. There are buyers and there are providers, and this transactional activity for which somebody would expect compensation is a big piece of that. So the legal term has become confused with the mainstream usage, which tends to involve people being forced into prostitution. And this has led to a lot of confusion all around. So this came from a media guide on sex trafficking, and it just talks a lot about how when we conflate or confuse the profession of sex work to the exploitation of human trafficking, we create this narrative that is just, it becomes very, very confusing, and it's hard to pick out the pieces of what is consensual, what is not, what is coercive, what is not, right? So it creates this really big element of confusion. So when we look at the realities of trafficking and exploitation, so here at Family Support Center, we believe that human trafficking is a human rights issue, that all victim survivors are entitled to equal access to aid mechanisms, so resources, support systems, protections like restraining orders, justice to criminal justice system, or transformative justice remedies, options that are or what they feel is going to be the most justice and healing process for them. that they should be affordable opportunities to access in any way that they so choose. And we believe that human trafficking is driven by capitalist systems, poverty, oppressed structures like racism, sexism, homophobia, and health and opportunity disparities, which stem from those. So when we look at this like triangle graphic that we see here, this is the capture of all survivor experiences, all the different colors, all the different blobs. Those are all the different things that we see experienced by survivors of trafficking. It creates this funneling effect. And when we look at this popular perception of trafficking, you see the orange color. There's about 3 of them in that whole graphic. And when we look at just that, we are neglecting the experience of all survivor experiences by only focusing on the one. So we are missing opportunities to give resources, education, and support to all of those other survivors because we're only talking about one kind. So using this anti-violence framework to address trafficking means we are centering the voices of survivors. They are the experts of their own experience. I am not obligated or ever going to tell somebody that what their experience is and define it for them because I did not live that. I did not experience that myself. Being non-judgmental and offering options. So that's kind of where a lot of the healthcare professionals come in. Not everybody that is being exploited wants to be saved. So it's important to know what other options there are for helping these survivors, referring them to those resources, creating a space that is judgment-free. Because a lot of the times, I mean, even in my own experience, going in for a doctor's visit, I don't want to feel judged or, they ask those questions that they're obligated to, right? But sometimes you give the answer and you get that side eye and it's like, oh, great. Now I feel like I can't be fully honest with my doctor, right? Being non-judgmental is the key to creating and building rapport with folks so they feel safe to disclose if they so choose. And no resources that are not going to re-victimize or stigmatize that survivor experience. So having continued education on all of these structures that motivate violence or that capture violence, educating yourself on sexism, racism, homophobia, or all these other systematic issues that play a role in victimizing folks. And also knowing those resources that are survivor informed, victim centered, empowerment based. If somebody identifies as having a very strong attachment to a specific religion, knowing resources that are going to be safe to them, right? If somebody is an atheist, doesn't have a religious affiliation, knowing resources that are not going to re-traumatize them or that will give them services without having to specifically identify as a specific type of person or having specific beliefs, having resources specific to LGBTQ survivors or those of a specific race, right? Making sure that the places you are referring folks to are trauma informed and are not going to re-victimize that person. And again, we believe that human trafficking is driven by these capitalist systems. And know that just because something feels wrong or makes you uncomfortable does not mean that it meets the definition of trafficking or is even considered a crime. There are so many elements of sexual assault, domestic violence, exploitation that don't meet a definition that can be prosecuted in the court of law. And that's probably one of the hardest parts of the job that I do, is having those conversations with people of what happened to you is awful and you do not deserve to go through this. But this is what the statute says. And this is what says has to be met for a charge to come forward. And it sounds like from what you've told me that you went through something terrible, but the law doesn't see it that way. And it doesn't mean that I don't believe you. It just means that we can't go that route for you to get justice. And what route can we go now, right? And then just because something doesn't meet that definition doesn't mean that it's not okay. They still didn't deserve it. They still didn't deserve to feel unsafe, be taken advantage of, or be exploited in any way. Let's see, I want to be conscious of time. Okay, so we still have quite a bit. We're good. So what populations are vulnerable to being human trafficking and why? Anybody at any time. can be exploited or trafficked. However, it disproportionately affects those with a history of trauma. Some of the businesses or places of employment that we see most often is, escort services, illicit massage parlors, outdoor solicitation, domestic workers, pornography. Pornography is a big one. It's really hard to tell at any time on any site whether or not the porn you're watching is consensual. It might seem like it, but they might be being forced. You don't know. So that's one really big one that's talked about a lot. Restaurant and food services, that's a really big one. Architecture and animal, health and beauty services, hotels, construction, landscaping, right? All of these different elements where we see people being exploited. That's a long list of professions, right? Someone could be trafficked at anywhere, at any time, at any place. It doesn't need to fit this narrative that has been constructed by modern society. Okay. So some places that we see more vulnerabilities for being trafficked is systems involved youth. So the lack of instability, lack of community, inadequate social safety networks, especially during that transition into adulthood. So those late teenage years and what that looks like. Individuals that identify as being LGBTQ, especially LGBTQ youth, they have a high chance of being rejected by their family. Again, has a lack of community, and they have insufficient healthy relationship education and representation. It is, in my opinion, that one of the absolute best ways to prevent any type of violence in youth within intimate relationships is to have comprehensive sex education in school and at home that talks about all of the different ways that you can stay safe, especially focusing on consent. When I took health class in high school, I don't even think the word consent was used. All that was talked about was how to put a condom on a banana and don't get pregnant, right? That was it. That was the extent of my sex education until I got to college, right? Then it was talked about in classes, and I was mind blown at the fact that these conversations were happening, right? Because I was never given that opportunity in school before. And a lot of the times, parents aren't talking to their kids about this stuff. Children are learning through pornography. They're learning through self-exploration. They're learning through unhealthy and sometimes healthy relationships, right? That's what we all hope for. But having those conversations and having that comprehensive education is so necessary in preventing forms of violence in youth. People with addictions, so that criminalization, right? In access to treatment options. Oh my gosh, the wait lists, the cost is ridiculous. Addiction linked to existing trauma, in my opinion, and in a lot of experts' opinions, the number one gateway drug is trauma. It is trauma that people are self-medicating and coping through using substances. Whoops. People with that conviction history, so lack of post-conviction opportunities, right? Probation is so overran. People working in those positions have caseloads beyond my even comprehension, right? They're not able to keep track of everybody and give all the opportunities to everybody. They're isolated from the community at large. People with felony convictions have harder times getting a job, finding housing, finding healthy relationships, staying away from those people that were bad influences prior to them having this incarceration history. Low confidence in their protection capability. So if something happens to them, they're not going to want to call the cops because that's not a safe resource for them. But what other resources are there, right? These are conversations we need to be having. And then people facing economic insecurity. So again, lack of employment, housing, medical care, food. I mean, I know that medical care is not mandated, or having insurance is no longer mandated, at least in Wisconsin. Someone correct me if I'm wrong there. But when it was, I mean, that was a huge thing, right? So many people were having to pay for this insurance, even though they couldn't afford it. And that doesn't mean that they even could access those resources because they still weren't affordable. I know that's something I struggle with, having access to affordable health care. And I have a pretty good job, right? I have insurance, but it doesn't mean that's still not something I struggle with. Having limited choices and critical needs, right? That drives their vulnerability, criminalized survival mechanisms, right? All of these different things. those that are undocumented. So they have that lack of community, that visibility. They have a very much justifiable fear of the criminal justice system and other systems in play. They are criminalized survival mechanisms, right? People that come to this country for safety, to escape unsafe situations in their home country. Oh my gosh, I can't even tell you how many awful things I've heard about them when, gosh, if I was in that position, I would want to go somewhere else too. That language and cultural barriers. I mean, even especially in healthcare, the use of interpreters, licensed interpreters, not familial interpreters, which I know can sometimes be a barrier for folks to how do you access these interpreters? What if there isn't one available right away, right? I was just watching a show last night. I don't remember which one it was, one of the many medical dramas out there. And they used a familial interpreter because that was what was available. And that person wasn't accurately giving information to the patient because they were trying to protect them from their diagnosis. When if they had a licensed interpreter, somebody that was obligated to word for word share the information that was being given to them, that would have never been something they had to deal with after the fact. People with disabilities, so the rampant employment discrimination and the lack of opportunity employment, Medicaid related restrictions on assets and income. So somebody that is on those resources can't have so much in savings, they can't marry without losing their benefits, right? All those barriers put in place. The stereotype is lacking credibility as an individual agency. People that are seen as less than or inadequate or unable to because of their disability, and especially those invisible disabilities, one that's not physically seen on the outside. And people with a trauma history, right? We need to understand an unaddressed trauma that can cause cascading effects that lead to other vulnerability factors. So mental health disparities, economic insecurities, things like that. And then the historical systems failure that lead to that low confidence in systems that are put in place to help, but are not always able to because they don't have the capacity to serve all of these individuals with trauma independently. And like we talked a little bit about earlier, ACEs, right? So ACEs are one of the most common identifiers to determine risk of exploitation and other forms of harm. So most survivors of trafficking or exploitation disclosed having other forms of harm in their lifetime. And all of the survivors I worked with in the last grant year, which was about 6 months worth of data, every single one of them had co-occurring victimizations. Every single one of them had experienced some other form of violence in their life, whether that had been in their childhood, during or after their trafficking experience. So what are these adverse childhood experiences? Traumatic brain injury, so any type of physical injury, mental health, depression, anxiety, suicide attempts or thoughts of suicide, PTSD, maternal health, so unintended pregnancies, right? The restrictions on abortion across this country is I'm not even going to get into that today. Complications, fetal death, looking at that in correlation with race and what that looks like across the spectrum. Infectious diseases, HIV, SIDS, STDs, that kind of stuff. Sorry, SIDS is not an infectious disease. I take that back. Chronic diseases, so cancer, having diabetes, having untreated, mental health disorders, things like that. Risky behaviors, using drugs and alcohol, having unsafe sex, exposure to these unhealthy or unsafe relationships, then that the opportunity disparity, education, occupation, income, ability to get into secondary education if they so choose, pressure to perform in school when they're dealing with these other things at home. So trafficking is misunderstood and seen as one of the worst forms of victimization somebody can experience. And that is simply not true, right? People get to identify what their experience was and what was worse for them. This doesn't mean that somebody who has been trafficked is at this top tier of victimization. There is no hierarchy. We reject that. It doesn't exist. there is a history of abuse or neglect. It can cause survivors to see their exploitation as not so bad, right? Because, oh, well, he doesn't beat me. She doesn't force me to, sit in the corner all day and listen to my friends around me get harmed, right? They might not see what they're doing as being exploited or being trafficked as bad as experiences they had previously in their life. The relationship to their trafficker often involves love, affection, admiration, and they confuse harm with romance and thoughts of love and affection with pain and suffering. And extensive grooming can make it very difficult for survivors to see where harm has taken place. And now we're going to take a moment to stop listening to me talking because I've been talking for quite a while. And we're going to watch a video that is through DCF, the Department of Children and Families, that talks about vulnerabilities for those in being trafficked. And you'll see in here, there are multiple members of the task force that myself and my colleague who's on this call, Emily, are in, talk about these vulnerabilities and survivors they have worked with those vulnerabilities. Now, somebody let me know if you can't hear the sound. I might have made a mistake in how I shared this, so. Can folks hear that? Yes, okay, fantastic.
Availability and vulnerability. Kids who are successfully
Oops, sorry.
scolded often are kids that have a lot of unsupervised free time, and so they are available. And vulnerability means that kids that are looking for an adult who will listen to them. And these traffickers will spend hours while they are grooming a young person, listening to them and validating their feelings and telling them what they want to hear. And that's just a prelude to then grooming her further and turning her out. So the two risk factors really are availability and vulnerability.
The preying on the vulnerable, finding a weakness in others and then capitalizing on it for your own gain. Capitalize on the value that they want from you, which is normally selling of your body in exchange for what they want, and which is pretty much love and acceptance.
When we're teens, we're taking chances. We're trying to figure out who we are, separate from our parents, from our families. So, there's inherent risk with that. I'm gonna push the boundaries of things. I'm gonna take chances.
With sex, with drugs, a number of things. So that makes them particularly vulnerable to exploitation.
Traffickers will look for victims out in the streets. They'll look for victims at malls, at different stores, and tell them how beautiful they are, maybe how they can make lots of money. And many times the victim is taken in by that, especially if there's other issues going on, like if they've run away, if they've got nowhere to go.
A lot of times folks that are trafficked, their first experience of sexual victimization was not their trafficker. It happened when they were 3 or 4 or 5 or 7 from someone who was known to them, a nephew or a cousin or a brother's friend who came over to the house for a party. So you've got somebody whose sense of self-worth is pretty fragile to begin with.
Where the traffickers are finding their victims, they're using a lot of online techniques. They can use social networking, and they're going after the victims who themselves have had a lot of problems in life.
So I met him online on Facebook, and that's kind of where it started. Within the first few conversations, he was all about my life, and I opened up to him about it because, at the time I did not have very many people that I was in contact with anymore. So I feel like he just learned so much about me early on, and I feel like that's how he knew I was vulnerable.
And oftentimes the relationship is fostered through peer relations. So it's like, hey, come and hang out with me. We're gonna go to this party together, and then inevitably there's an older male, generally, not always, but who's there, just kind of like, yep, I'm the person responsible for this party. You're having a good time. What do you need? Do you need a place to stay? You don't want to go home tonight? That's cool. You can stay here. Oh, do you want your, nails done, hair done? You want some new shoes? I can take care of that. Let's go out of town for a weekend. Do you think you can do that? And it's all things that a teenager would love to hear. I'm getting attention, I'm getting validation. This person appreciates me, they respect me, they think I'm beautiful. I mean, it's just all these power and control dynamics that young people don't understand, but they like hearing.
You can't move this situation to the suburbs and think it's going to be okay. You can't move it, into a hobble in Japan and think it's going to be okay. Wherever there's children, there's vulnerabilities and a need to feel loved and accepted. And the puppeteer guy or girl that wants to use that to make you make money, help you get wealth, then that's what they're going to do.
It's not the creepy old man from down the street, like who you would think. And it's your normal, typical person that try to get you into that sex trade. And, they got the money, they got the, flashy things. So young girls like me, especially with nice cars, young girls like me or somebody that's vulnerable or something, they'll go with him and think like it's all about them finna be in a relationship, they gonna build an empire, they gonna be the next big thing, Beyonce, Jay-Z taking over.
Traffickers, their main commodity that they're exchanging for someone to be trafficked is love. It is the idea of giving somebody love, affection, attention, validation.
Parents that really talk to their children are telling them, don't talk to strangers. Well, this girl is not strange, she's in my classroom. She lives right next door to me. I know her name, so she's not a stranger. But this guy that will walk up to you and start talking with you or trying to chat with you on Facebook, he's one of those stranger dangers. I don't want to talk to him. But if you're vulnerable that day, you might, because he's paying attention to you.
The young trafficking victim is far more likely to say, he's not abusing me or hurting me. He's my boyfriend. He provides me safety. He takes care of me. Other people in my life didn't do that, and he does, and that's why I'm doing this, and it's none of your business.
One pimp said, if I get in your head good enough and make you believe everything is golden in what I say, their bodies will follow,
The pimps make you feel the love and acceptance. I guess acceptance too is a major thing. Or feeling like you're doing something good.
Especially I feel like if you didn't have that, never had a male figure, and you done met this man that could be your father, and he loving you like a woman and treating you like something you never felt before. And so I understand that, because everybody wants to be loved, but it's the wrong love.
You don't understand just how smooth people can be when they want to take advantage of you. They're going to take advantage of your youth, your innocence, your willingness to be cool and risky and try something fun and new. In a moment, in one night, everything can change.
All right. Any thoughts, questions, comments about that video that we just watched? I think it talked about a lot of really great things. A lot of kind of what we've been talking about here and what those vulnerabilities are and what to expect. Can I share the link? I sure can. We are about to go into a break. We're running a little ahead of schedule, which is great. So while we were on that break, I will drop the link to that video. It's actually part of a series. We'll be watching another one of the videos later. Okay, and a cool movie called John Doe. Preston, do you know what platform that's on? If you do, you can drop it in the chat, but I would be interested in watching that. But yes, I will share the link to that video and to the whole series. And we will take a 5-minute break and we will come back at, let's see, at 9:40, right? Yeah. All right. I will see y'all back here in about 5 minutes.